So for my chapter 15 discussion, the brain and cranial nerves, I decided to teach about the clinical views. Clinical views 15.3, actually. So, traumatic brain injuries. Um, I'm going to read this definition first. Refers to the acute brain damage that occurs as a result of an accident or trauma. So, everybody knows what a traumatic brain injury is. It's a traumatic. It can be like a concussion. Can be a mild example of a TMI or TBI. Excuse me. And actually, right here it says a concussion is the most common type of TBI. So there you go. It is characterized by temporary, abrupt loss of consciousness after a blow to the head or sudden stop of moving head. So, headache, drowsiness, lack of concentration, confusion, and amnesia may occur. Multiple concussions have a cumulative effect, causing the affected person to lose a small amount of mental ability with each episode. So obviously you're gonna get some pretty good brain damage. Your brain's not very good at fixing itself after a traumatic experience. A contusion is a TBI, traumatic brain injury, where there is bruising of the brain due to trauma that causes blood to leak from small vessels into the subarachnoid space. The bruising may appear on a computed tomography, a CT scan. Usually the person immediately loses consciousness. Respiration abnormalities and decreased blood pressure sometimes occur. Of particular concern is a rare but serious condition called second impact syndrome, SIS, where an individual experiences a second brain injury prior to the resolution of the first injury and develops severe brain swelling and possible death. For this reason, it is essential that the original TBI completely heals before an individual is allowed to resume a behavior that may have put the individual at risk. So if you get a TBI, obviously they're not going to just let you go out and continue your football career until you can, until your brain is healed and until you're better, and because you're at a high risk of getting an SIS, which obviously terrible. That's gonna be really, really bad. Both severe traumatic brain injury and repetitive TBIs may cause long-term cognitive deficits and motor impairment. Individuals may need physical, occupational, and speech therapy to regain a portion of these functions. So, patients who come in with a TBI or an SIS have shown much greater recovery speeds and actually overall recovery when they go to therapeutic progesterone. Thus, a reproductive hormone also appears to help the nervous system with its healing. That is it for my clinical view on my discussion of chapter 15.